It's 12:05 here on 90.3 FM WEJF, and time for the Wednesday edition of Helping Seniors of Brevard. As we get the show underway, here's Kerry Fink. Hi, Kerry.
Hey, John Harper. Thank you and welcome. It's our Wednesday lunchtime get-together right here on 90.3 FM WEJF, Helping Seniors Radio. And so on behalf of our president and founder, Joe Steckler, our education specialist, Kim Bernard, and our entire radio crew, and I'm going to introduce them one by one because we have a bunch of, this is also a mile marker in COVID history. This is the first time that all of us in the studio have had our vaccinations, and so we're able to be mask-free in the studio. And you'll see that on our photos when, we always take a photo after the show of everybody in the studio. And so for the first time in 14, 15 months, however long this has been, we're able to be in the studio together, and kind of things are getting back to normal. That's pretty exciting. So let me, without further delay, we've got so much to get to in this show. A lot of great information. Call your friends, gather around the radio, because there's going to be something in here that's going to be of value almost for everybody. So Jennifer Helin with Seniors Helping Seniors of Brevard, how are you doing today?
I am wonderful, Kerry. It's great to be here.
And for those of you that know, not only does she own and operate Seniors Helping Seniors of Brevard, providing excellent service, I guess you call it, we always talk about it as being the first rung of services when you're trying to get help at home, right?
Yes, a lot of times we are the first person in when someone needs a little bit of help. So Seniors Helping Seniors, we're a homemaker companion, home care agency, but we really do hire seniors to go out and help seniors.
Yeah, and we're going to be talking about that because you actually have job openings available.
We do. We would love to hire someone who has retired, fooled around a little bit, and is looking for something to do that they feel really, really good about. It's very flexible. We keep you close to home, and it gives you some ad money.
We're going to be talking more about that. I also want to introduce to you another longtime friend of the Helping Seniors organization. It's Dr. Kevin Kilday. He owns and operates Holistic Health Center, and we actually have a somewhat serious topic we got to talk about today called COVID-19 long haul syndrome. How are you today, Dr. Kevin?
I'm great today. I'm glad to be here. Thank you for the invite.
Yeah, and I'm excited to get into this because this is important information. We were talking before the show that some people who have survived the COVID are really still dealing with ramifications from it. And so we definitely need to stay on watch about all that. So we're going to come back and talk a little bit about that. And also our third guest today, we are so fortunate to have somebody who is one of these really tireless and unsung heroes on behalf of seniors here in Brevard County. She has worked for many years with the Department of Children and Family Services, the Adult Protective Division. It's none other than Theresa Russell. How are you today, Theresa?
Good. Thank you so much for having me.
And we are going to be talking about a date you need to get on your calendar right now. It's June the 11th, and it is for the World Elder Abuse Awareness Day event. And we're coming up on this. This is all going to be taking place on the grounds of the Melbourne Auditorium in Melbourne. It's a free event, lots of fun things going on, but it's very important to get this information out. And how many years, Theresa, have you guys been pulling this together now?
This will be my 11th year.
I'm thinking about this because, this is our 5th annual Helping Seniors car raffle that is coming up, and we're going to talk about that as well. But I was thinking back, Theresa, you helped us launch this whole thing at so 5 years ago when AJ and Joe Steckler, our president and founder, sat down and talked together, and AJ goes, I've got a car. He goes, I'm going to give you a car out of our personal collection and help you guys do a fundraiser with it. And that's how we got started with the Helping Seniors car raffle. But you were kind enough to let us have the car on display, and I remember this big ceremony where Joe was handing over AJ was handing over a key to the car to Joe, and it was kind of the kickoff for the whole thing. So you have really been at this for quite some time.
Yeah, it's been a fun event. It's something that we feel really passionate about, letting people in Brevard County know what services are out there to help their family members and to live happy and healthy lives as long as we can in our homes, and just getting the services we need in home with us.
So let's just start while we're on this topic. Again, the date is going to be Friday. It's going to be June the 11th, and because again we're coming just out of the COVID era, I guess it will become to be known. But you guys have created a lot of events trying to still keep social distancing in place, keep folks safe, and do all that. So you're actually going to be doing things on the grounds of the auditorium more so than inside. Is that right?
Correct. None of the events will be inside this year, and we've tried to include a little more family-friendly events. So we're going to start with the 5K One Rock around the area of the Melbourne Auditorium and over there by Holmes Regional. And so that'll start at 7. Try to keep it early enough where it won't be too hot to get started. And then right behind that, we have a 1 mile senior stroll. It's 1 mile, it's 2 loops around the pond there at the Melbourne Auditorium. And along with that, while you're walking, there'll be a little memory game to play. And when you finish that 1 mile stroll, there's a couple questions you have to answer. And everybody who answers them correctly will go into a drawing. And the winner of that drawing will get a 65-inch TV.
Wow. Well, that's pretty exciting. And then you're also having a senior drive-through expo thing that's happening there as well, right?
Right. All of our vendors will be outside in the parking lot, and our participants will stay in their cars and go from booth to booth so they get a chance to talk with everyone and get all that valuable information from all the different people that will be out there with us. And it's all about supporting our seniors and supporting our community.
So basically, you could just plan your morning out there, right? You start, if people want to be part of that, the fun run. You said that starts at 7, right? And then when is the expo part of this all happening?
9 o'clock we'll open for the cars to begin going through the expo, and that will be till noon. Probably a little after, because we'll shut the line down at noon.
Okay.
But it's been a very popular thing now since COVID, having these drive-up events for seniors, and everybody seems to be enjoying them. And so we decided to go that way this year and make sure everybody's safe.
You know, it's always been a great event, and I was going to say, we're certainly going to be out there helping seniors of Brevard. We will be out there. In fact, we're planning to have at least one of the raffle cars out there, if not more. And we're excited about the opportunity of just getting together with all these people who are serious about the welfare of seniors and the seriousness of the message that goes behind the elder abuse awareness. Because in your role with DCF, that really has become something that you've really spent a large part of your time trying to combat.
That's kind of been my goal, is to be more proactive and letting people know how to not become victims of abuse, neglect, or exploitation. DCF in its face is reactive. Mm-hmm. Something occurs and then they'll send out an investigator or send someone out to assist you. And we're trying to get more information out to people so that doesn't happen. And when they see it start to happen, then they'll know how to put a stop to it.
Now, that's so important. And Jennifer Helin with Seniors Helping Seniors, you guys are going to be out there as well, right?
Absolutely. We've been there the last, probably at least 5 or 6 years that we've participated, and always look forward to it. It's a great event. It's a lot of fun. This year with the drive-through, it'll be a little different, but it will still be a lot of fun. Can't wait to see everybody out taking their walk and doing the 5K. I would love to do the 5K, but I need to be not sweaty and nasty to say hi to everybody as they come through, so I'll behave and I'll make sure that I'm nice and fresh when everybody comes through.
Now, that's good. But, I was thinking about this. Not only do you, in addition to running a successful business called Seniors Helping Seniors of Brevard, you also sit on the board of Helping Seniors of Brevard. That's us. We're the nonprofit charity. But you also have been involved through Triad and some other areas, so you're quite aware of the reasoning behind the World Elder Abuse Awareness Day. Yes,
I actually sit on the board of Triad as well, and this is something that DCF and Triad put on together. So Triad is a big sponsor of the World Elder Abuse Awareness Day, and very happy to have that out there, because Teresa's right. If we can be proactive, it will save a lot of heartache, so that DCF does not have to come in after the fact and try to put things straight. So it's good to see that people are, helping seniors. We talk about having an aging plan and putting things into place, and that's exactly what this is trying to do. Is let's put things in place so that things don't happen.
Yeah, no, I'm right there with that. And Dr. Kevin Kilday, we're talking about World Elder Abuse Awareness Day, which happens Friday, June 11th. It's actually celebrated internationally, but here locally in Melbourne, Theresa Russell and has been sort of spearheading this project for. Did we really say 13 years? 11 years. We said 11 years, but that is significant because the key is all about welfare of seniors. And so, Dr. Kevin, are you guys going to be doing something for World Elder Abuse Awareness Day?
I have no plans yet, but I am available to help out any way I can.
Can you wear purple that day?
Sure.
There you go. Purple is World Elder Abuse Awareness Day. That is the color.
Yeah, you should definitely be involved. This is so important because over the years, Joe Steckler, our president and founder, we've done so many TV shows, radio shows, and some of the most frightening statistics about elder abuse, I think, is the fact that a lot of times it happens kind of with people that you would hope wouldn't abuse the elder, but it ends up being a family member or some story like that. I mean, are there statistics as you go out and you share publicly, Theresa Russell, with that you're explaining the problem? Because many people maybe aren't even really aware that it's quite as large a point as it is.
Part of what DCF does we're under Florida State Statute 415. And 415 deals with someone who is a familiar to you, be it a family member, a household member, caregiver, someone in that role. We don't deal with that strangers. Those are under civil statutes if something occurs with a stranger. But we deal with those people that are supposed to be there helping you and assisting you. And the biggest part of what we do, we're not a prosecutorial agency, although we do work with local law enforcement and the state's attorney's office. We're more about stopping it and putting in place things that will keep it from happening again.
The thing that I've learned along the way, and I was going to ask Jennifer if you want to comment on this. To me, this was surprising. I know you're so involved directly in the work of working together with seniors in their homes. But the thing that was unusual to me that I learned from Theresa was that I guess we have this perception that if somebody calls Adult Protective Services, they're going to take mom, grandma out of the home, and it's just going to be this big complex thing. But really, what you've explained is that the object is to be able to not do that and have everybody stay safe at home, really.
And this is Jennifer. I'm sure Theresa could really do a great job in explaining that. But I'll say from an outsider's standpoint, who has seen this happen many times with clients or with clients that we've come in after the fact. Absolutely. There's this misconception. There's a fear out there. Oh my gosh, don't call DCF, don't call DCF. But really, they come in, especially with our older adults, they come in, they assess the situation, they offer services, they figure out what's going on, and they really try to help. And they really want to keep people in their home where they want to be, as independent as possible. If it's a safe place to be, then they're going to help keep them there. So it's not... I just had recently where a sister is caring for her sister, who is probably likely incapacitated, unfortunately. But DCF was called, and they came in and they assessed the situation. Of course, the daughter or the sister called me in a total panic. I said, "No, please don't worry. It's okay. They are going to do their due diligence. They're going to look at everything, but." In the end, this may be a very good thing because
right.
She's, the sister's not accepting any services. She's not accepting any help. This will help you with that problem. They will come in and they will guide you. They'll have a social worker. They'll have someone there with you to help guide the sister in accepting some services that she really actually does need. So it's sometimes, as scary as it may be, it's a huge benefit.
I think so. And I know Theresa Russell with Adult Protective Services and also the organizer for helping get all of this together for Friday, June 11th at the Melbourne Auditorium and the events there. But, I've heard you talk many times about don't be afraid to call the adult abuse hotline. Can you talk about maybe just real quick, like when do you call? What should somebody say, wow, I'm concerned about this, now's a good time to give a call.
If you have any indicators, you just have that feeling that somebody's not getting their needs met, whether it's they have a caregiver or they have someone who's helping them, or they're by themselves and they're just not able to meet their own needs, that's the time to give the hotline a call. And that's 1-800-96-ABUSE, ABUSE. And the idea is that an investigator will go out, see what's going on, assess the situation, and see if services will assist this person to remain in their home. Our priorities are not to remove anybody from their home. That's the last thing we want to do. The idea is to get services, give referrals, help the caregiver get their supports so they can continue to be the caregiver. We all know providing 24-hour care 7 days a week for somebody is just overwhelming sometimes. So maybe just getting them some resources so they can take an hour or two off, or if they have something they need to attend to, getting some respite to care for the person that they're caring for. Just supporting that whole family unit to help care for this family member that needs that extra assistance.
You know, this is so important because this really dovetails with the program that Joe announced. Joe Steckler, again, our president and founder of Helping Seniors, announced, and he's been writing, you may have seen the articles. I think there was one in this week's Hometown News. You've certainly seen it in the Senior Scene magazine, where every place he writes columns. You know, he writes for Aldea Today, Ebony News Today, just all these magazines, newspapers around our county, because he wants to get information in the hands of seniors that helps us do the right thing for seniors, but also the families that are trying to look after seniors, right? And so his program is called Stay Connected, and it's a whole thing that we've already had retired registered nurses call in and say, hey, I want to volunteer, I want to be part of this. And a lot of it is that whole thing, Theresa Russell, that you're talking about, right? Because it's not, sometimes it's not necessarily a case of abuse. It could be just a case of the person is there by themselves. So you might classify it more as neglect or inability to take care of themselves.
Yeah, that would be a self-neglect in essence. And sometimes the person just doesn't know who to call and doesn't understand there are services out there. And like anything that we all go through, sometimes we feel like we're the only one going through it.
Right.
And there are a lot of other people out there struggling with that. Even they have a lot of different online caregiver support or personal support things that you can go online if you can't get out to the house and get to a support group. And they talk about it and you find, oh, look, here's all these other people doing this too. And they give each other hints and ideas on how to get through it and services to go through. It's kind of, we're more of a service referral, if you will. Just letting you know these things are out there for you. So don't be afraid to tag into them and get those extra services. A little help can go a long way in keeping you healthy and safe in your own home.
Well, I'm thinking that's almost a great segue into what Jennifer does with Seniors Helping Seniors. But before we jump over there, I do want to let's just recap. So you got to hopefully get a chance to get a something to write, a pencil and something to write these dates down, because we're gonna throw a lot of dates here at you, and these are all good dates that you're going to want to keep up with. But again, the date for the World Elder Abuse Awareness Day Community Fair is going to be Friday, June the 11th. Sounds like we're kicking off at 7 a.m. with the fun run, but then the drive-through, and that's a pleasant little lake area to walk around and all, so it should be a beautiful morning out there. And then combine that with the Senior Expo. You said that starts at 9 and runs till noon. Am I saying all that the right way?
That's all correct.
And it's absolutely free, right? If you're coming out there, you just want folks to come out and learn.
Well, now the fun run and the senior stroll, you can register through Running Zone for those, because we'll be doing T-shirts and medals for all those runners.
Oh, well, that's fun. So how do people, if they want more information, what's the best way for them if say, hey, I do want to do that? How do they get involved in that?
They can go to the website, World Elder Abuse Awareness Day, and it's all listed there.
Okay. Well, that sounds like we're going to have a lot of fun on June 11th. Jennifer Helin, you're going to be there. I'm sure Dr. Kevin Kilday, you're going to be there. I know that Kim Bernard from our office, Chris Morse from our office is going to be there. We're going to have a Helping Seniors raffle car out there, and you're going to be able to see the cars, get your tickets there on site, and just learn a lot. It's just such a great educational forum. So we're going to shift gears a little bit, and we're at least going to start. We only have a couple of minutes before we get to mid-show break, but this is pretty serious, Dr. Kevin Kilday, this whole thing that you call COVID-19 long haul syndrome, and we're actually going to get into it because you're writing an article that's coming out shortly in the Senior Scene magazine in the Helping Seniors newsletter, right?
Yes, this is scheduled for the July issue.
Okay.
Yeah.
So what does it mean? Until you guys were talking about it, as we were starting the show, I really didn't know the term. What does it mean?
Well, it's the medical industry is actually calling it a phenomenon because they don't really have definitive answers for it. All right, it seems to be that people who have had the COVID-19 virus and recover from it, become a survivor, they seem to be having long-term symptoms that they can't get rid of. They end up with the chronic, overwhelming fatigue, joint and muscle pain. One of the biggest complaints is brain fog, just lack of concentration, and also mentally there's a lot of accounts of depression and anxiety going along with that also, and it's just they're doing numerous studies as we speak on these symptoms, but I think the medical industry is actually calling it the post-COVID-19 syndrome, but also known as long COVID, and the people themselves are considered long haulers.
Yeah, I noticed you put in the article because it's a logical question. Are these people that are experiencing these symptoms? Does that mean they're like contagious for other people? And
so far, the answer is no.
Okay.
Not at all, because they found with the coronavirus, it's only contagious for 1 to 2 weeks, and then after that, it's no longer contagious to people around them. But they're looking into that. That they have some theories that the virus is could be very deep into their body. That they're focusing on the gut, maybe on the gut microbe, and and they're looking at various a lot of different areas.
Well, it's a fascinating topic that we need to be aware of. When we come back on the other side of the break, I actually want to talk to you a little bit because your specialty, Dr. Kevin Kilday, is holistic health, and we're going to talk about nutrients and supplements that are helpful. You've talked about this a lot during the Way on COVID. We have so much to cover. We're going to be back with Jennifer Helin with Seniors Helping Seniors, Theresa Russell with DCF, Adult Protective Services, and the WEAD fair that we're talking about for June 11th, and Dr. Kevin Kilday with Holistic Health Center. Stay right here.
12:32 right now here on 90.3 FM. You're listening to Helping Seniors of Brevard, heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM. Right now, let's get back to more of the show, and here's Kerry Fink.
Thank you, John Harper. Wow, we're having a really great conversation about so many topics. We started out the show really talking with Theresa Russell, who is with DCF, the Department specifically of Adult Protective Services, and talking a little bit about this great event that's coming up on Friday, June the 11th really it starts at 7 a.m. if you're going to be involved in the fun run and some of those things, but then it kind of winds through the day with the senior walk, and then from 9 to 12 we get the Senior Expo, and of course Helping Seniors will be out on site for that drive-through expo. We were talking that Jennifer Helin with Seniors Helping Seniors, you guys are going to be out there and on point for all of that. And then we were talking with Dr. Kevin Kilday, who's also in the studio today with Holistic Health Center. And actually, as we're going into the break, we're talking about this thing called long hauler syndrome. And I really didn't know that. So again, if somebody's just joining us back in, just real quickly, explain again what that is.
Well, it's for anyone who's had the virus, the COVID-19 virus, and has survived it, are ending up with residual symptoms for up to 6 months or more. Some of the complaints are chronic fatigue, very similar to the symptoms of chronic fatigue syndrome. Also, another big complaint is overall joint and muscle pain. Again, the symptoms are very similar to fibromyalgia, but the medical industry are doing studies to find out the exact reason why people, and it's up to 30% of the people who've had COVID are experiencing this, and also it's affecting all ages, from young teenagers all the way up to the elders. It's affecting everyone. So this syndrome has no age difference.
And we were talking about that. Again, we were joking at the start of the show. This is kind of like a landmark moment because we're all able to be safely in the studio together. And there's actually 1, 2, 3, 4, 5, 6 of us in here. And we're all able to be without masks because we have had our COVID vaccinations. And so I know it's highly recommended, if you haven't, to do that. But even Jennifer Helin with Seniors Helping Seniors, you were telling a story. You have people who've been through the COVID, and they've had some really difficult problems in the recovery zone.
Unfortunately, yes. I've got one very good friend that she recovered. She thankfully didn't have it real badly. She was never in the hospital. But she still has brain fog, and we're 6 months out.
Wow.
And she will still complain about brain fog.
Wow.
Significant enough that the other day she couldn't remember her dad's name. It took her about 20 minutes to remember her dad's first name.
Wow.
So it's something that is concerning to her, and concerning to us as her friends of how long will this last? Will this go away? What's happening?
Yeah.
And I know on break we were talking. I had access to Brevard County Fire Rescue had put out a YouTube. I'm not sure if it's available to everyone, but it was on YouTube, and it was about the long haulers syndrome of what's happening. And they were saying, there's no age, but there is the only way to prevent this is to get your vaccinations so that you don't get COVID, so you don't have this long haul syndrome. And there was some indication that if you do have it, this long haul syndrome, that if you get your vaccination, there's anecdotal evidence that it does help make the syndrome better.
Wow.
I don't know how much research is behind that, but boy, if it would make it better, I'd run out and get my vaccine.
Yeah, and I was going to ask Dr. Kevin Kilday. Again, Dr. Kevin Kilday is sort of our resident holistic health expert because you've done this for so many years. You sort of specialize in several areas. You do holistic cancer therapies. You do help folks with addiction recovery. And then you also do a lot with pain relief. But throughout this whole COVID thing, you've been sharing a lot of wisdom about things that we could do. In fact, you have another article that's coming out called Regenerate Your Immune System and Prevent Disease. And I would expect that some of the things that you talk about in there are probably helpful either towards limiting, effects of COVID or certainly, just in general, our health.
Yes, it was just kind of a review of some previous articles I've wrote.
Uh-huh.
And but one of the things I did really put to the top of the list was getting vaccinated.
Uh-huh.
Okay, and I actually say, regardless of how you feel, a conspiracy theorist or alarmist or whatever, that the only way that I feel as a medical professional to get back to some sort of normalcy is to get vaccinated. I mean, if there's I'll give you an example, but I won't mention any company names. But I know of a company that had numerous people in the company that were anti vaccine,
Mm-hmm.
and And as a result, one person got it, and it just ran through the whole company. There was a total of about 16 or 17 people in the company
Wow.
that
And
ended up with COVID.
And when you
of-
talk about this long hauler syndrome, this makes it like nothing to take lightly.
Right, yeah. And, I only mentioned, 3 things about the brain fog and the, and brain fog, in case anybody doesn't know, it's just, it's a lot of trouble thinking and concentrating. So that's what the definition of brain fog is. But there are there's a lot of hope out there. Let's put it that way, because there are supplements out there that have been shown to be effective with these with some of these things. But some of the other things that long haulers are experiencing, I only mentioned 3 and listed supplements to help with them in this upcoming article. But another great concern is chronic shortness of breath, which was one of the symptoms anyway of COVID, and people who were healthy, active, athletes and stuff, months and months later are still suffering from shortness of breath. There's also they're starting to see intermittent fevers coming back for no reason whatsoever.
Wow.
So I'm really researching this quite a bit, and I have come up with supplements that are shown to be effective with these symptoms. So if anybody has any questions, just please call me.
Yeah, I was going to say, let's get into that, because how you typically work with people is you'll sit down and give them you'll have a quick introductory kind of conversation, talk about the situation, and then from there you can meet either in person or you do a lot of Zoom calls as well with people.
Yes, because it is COVID. I've also introduced Zoom calling and Zoom meetings videos. So if anybody has a computer and is fairly computer literate, then we can do it without even being in person, just doing it through a Zoom video.
So
a Zoom meeting.
How do people get in touch with you then?
Well, my phone number is 321-549-0711. I personally answer the phone. If you get my voicemail, I try to call you by the end of the business day. So it's 321-549-0711.
And I want to point out, you have an excellent website too, holistichealthcenter.us. And you have a lot of resources there for people that they can look up as well.
Yes, I have because you mentioned before, like one of my specialties is alternative cancer therapies. I have a protocol on there called Winning Against Cancer. And, it's a whole protocol. Again, if anybody has any questions, just please call me. I also have a chart on there that I wrote of the 15 cancers in this country that are responsible for about 80% of all the cancers. And I've listed supplements next to each cancer. I couldn't find a chart, online anywhere, so I just wrote one myself.
Yeah, so it's holistichealthcenter.us. And folks, if you don't know, in addition to his work as a practitioner of holistic health, you actually also have a college where you're training other folks who are endeavoring to be of help to others as well.
Yes, we have experienced some delays, but we are less than 30 days away of officially launching that.
That's great.
We have we redid the website. We had to change the what they call the learning management system, and we were going to have 40 courses loaded up on the day of opening.
That's terrific. So again, if somebody wants to give you a call,
and it's all natural health courses, and the college is called Faith College of Natural Health.
That's great. So how do people get in touch with you again? One more time with the phone number.
321-549-0711. 321-549-0711. And my holistic consulting business is holistichealthcenter.us.
Thanks, Dr. Kevin Kilday. Really a great resource. And thank you, because he's really stood on the wall and tried to provide a lot of insight about, as we all keep learning more about not only COVID, but the ramifications, And Jennifer Helin with Seniors Helping Seniors, one of the things that I think collectively we learned early on was, after everybody sort of got a grip on what COVID was, we found out that when you did all the right things, it wasn't hard to keep seniors safe, but it was the problem became less about the medical safety, as long as everything was being followed, but it became this whole thing about the isolation. They couldn't see their families and all this. And this is one of the things that you guys really had to step up and deal with, because maybe the adult kids couldn't fly down like they would normally do and visit mom and dad for a week or two over the summer, or just things like that. And you guys really had to step up and be the eyes and ears and hands and feet and all that kind of stuff.
It's true. In the very beginning, when no one really knew what we were looking at, facilities shut down.
Right.
Nobody in, nobody out. A lot of our clients did the same thing. We don't want anybody in the house, because everyone was scared. And what we saw as months went by is that those folks were isolated, increased anxiety, increased depression, weight loss. There were a lot of other symptoms that went along with that isolation. And without having family members come in, especially if the family members were from Canada or California, New York, they couldn't fly down to come down and see their loved ones. So the families quickly realized this is not a good situation. We need to get Seniors Helping Seniors back into the house. In fact, now we're in a lot more than we were before in some situations because of that isolation. It really, unfortunately, did some damage.
Yeah.
So we're seeing, before COVID, we were getting calls, hey, can you go help mom maybe 2 hours a couple times a week? Now we're getting phone calls, hey, can you see mom 8 hours a day, 7 days a week?
Wow. And I know we were talking as the show was going that actually puts an interesting dynamic in play, because you are now really have opportunities for people who want to do work, who care about the safety and health and well-being of seniors, and you guys are hiring. You can really benefit from people who care about seniors.
Absolutely. We are hiring because we do have that increased need now. So we're looking for seniors. Now, we go with AARP, 50 and over. Not that I think 50 is a senior, because I'm there, but your definition of a senior gets older as you get older. So, but we hire 50. Our oldest provider right now has been on the radio show with me. He is 83. He'll turn 84 this year. Runs circles around me. He's amazing. So someone who would like a part-time job that they feel really good about. One of the things that I pride ourselves on at Seniors Helping Seniors is that we're really good to our caregivers. We understand they're seniors. They might want to go to see their grandkids. People are finally starting to travel and get out. So they're going to go up to New York and see their kids that they haven't seen in, almost a year and a half. And we completely understand that. So we're very flexible. We keep people close by so they know where the doctors are, how the grocery store is laid out. So it's a great position for someone who has that caring heart. A lot of our people have cared for a family member. They've cared for a spouse. They've cared for their mom and dad. So they have that caregiving experience. They know exactly what they're doing.
Yeah, I've got to think this has got to be a very fulfilling job. I mean, somebody would feel really good. Not only is it a job, so you have some more money. That's always helpful. But the reality is it has to be very fulfilling, because you're doing something very important, I think.
Exactly. We brought on a new caregiver just a couple of months ago, and after about 2 months of working with us, she sent me a beautiful email and said that she is almost feeling guilty because she is getting just as much out of helping people than she is giving. She feels like she's actually gaining more than she's giving. So it's a wonderful testament to what our caregivers do at Seniors Helping Seniors.
And I think that's one of the things. I think I asked you this before, maybe we were doing an update or something. I said, but, I guess a lot of us think like, well, but I'm not really like a medical professional. Is this something I can do? And you said, no. You're looking for somebody with the right heart and the right spirit and a real desire to help.
Right, because we don't do the medical, we don't do the hands-on. Our licensing is that first rung into the levels of care. So we don't do any of the personal care, we don't do any lifting, we don't help in the shower or the bathroom. We do all of the fun things, but that are needed in the house, on a day-to-day basis. We'll help take the trash out, do the dishes, make a meal, give medication reminders. So all of those day-to-day things that seniors need a little bit of help with.
Yeah, we were talking about, I remember at some point we had a conversation about actually that you're able to help even put together meal plans, because so somebody could come in maybe for like a couple of hours, they put together the meal plan, they're able to get the stuff at the grocery store, prepare the meal, and then it's available day by day for those next days. And we're thinking like, it's better than what oftentimes people by themselves will do. They'll go find a candy bar or something that probably is not the most helpful thing. And so there's a lot of benefit to what you guys do. But who should apply? I mean, who do you want to give your office a call and say, hey, I heard you guys talking about this on the radio. I just want to hear more.
So anyone who is 50 and over, like I said, our sweet spot are folks who have retired. They've fooled around for a couple of years and they're really looking for something meaningful to do, a part-time job that, yes, they will earn money, but they'll feel really, really good about. And though you mentioned the meals, whenever I see a stack of frozen dinners in the freezer, that's a tip off to me that maybe we could really be helpful. But the meals, what I love about that is the senior might have a favorite dinner that they cooked all of the time, but they don't do it anymore. It's a lot of prep work. It's a lot of chopping, different things. And so we'll make that recipe for them.
Wow.
And what a great conversation starter, what a great memory they have, the smells of that cooking. It's an amazing thing. What a social, emotional, wonderful thing just a simple family recipe can be to open up a senior's world. It is incredible.
So if somebody just wanted to get more information, say, hey, that sounds like it would be something I might enjoy. You're able to work with them like with their hours and the time that they want to devote to it. I guess that's another benefit, right? It's kind of flexible.
Yes, it is part-time. Typically, it's about 20 hours a week, but we are flexible. So have them give us a call, please, at 321-722-2999. We're also on the web. It's www.seniorshelpingseniors.com/Brevard.
Yeah, and you guys have been doing this for quite a while. We talk about, as a charity, Helping Seniors of Brevard is now in its 10th year of service in the community, but you guys have been at this for quite a while as well.
So 9 years.
Wow. And it just keeps growing, and actually the challenge that you really want to accomplish is finding good folks to help so you can serve more.
My policy has always been I don't want to hire anyone that I wouldn't put in my mom's house. But on the alternative side, I always tell our caregivers, I'm not going to put you in a house that I wouldn't put my mom in. So it goes both ways.
No, that's good. And you have a real knack for matching folks and, from both sides so that it is a win-win for everybody.
We really do. I just matched, I think you and I might have talked about this, just 2 or 3 weeks ago, we had a call from a daughter who went in, talked to the mom. Mom's very hesitant. The last caregiver they hired from an online source, it just didn't work out. It wasn't a good match, and she was very hesitant. And the daughter wanted her to have a lot of services, a couple days a week, lots of hours. And I said, let's start with 2 hours. Let's start 2 hours, maybe twice a week. Let's make sure it's a good match, and then we'll go from there. And if we do our job right, what I want to hear is, oh my gosh, I love her, and I want her to stay longer. Well, the first day, I did the introduction, and I knew we're good. Instead of the 2 hours, she stayed 4 that day. So it has increased, and it's been Mom's decision. Mom has said, yes, I want her back, more days, more hours. So it's taken that demand from the daughter, and now it's in Mom's hand, and Mom's the driver, and it's working beautifully. So that's really what we hope to do.
That is such a good story to hear when it works out that way. Again, if somebody wants to give your office a call and say, hey, maybe they do need help, but also the flip side is maybe they want to help and join you guys. Again, the number?
321-722-2999.
And that's Jennifer Helin with Seniors Helping Seniors. Well, so there are a couple of other things that we want to try to squeeze in. We've covered so much on today's radio show, but the Helping Seniors car raffle is full speed ahead. So we already talked about the fact that on Friday, June 11th, when you make your way out to the World Elder Abuse Awareness Day event at the Melbourne. Teresa's smiling at me because I always have trouble getting the acronym the right way. Did I do it right? Okay, so that is Friday, June the 11th. We're going to have a Helping Seniors car out there. Kim and Chris will be happy to sell you car raffle tickets and get you in on that because that is so much fun. Somebody is going to win their choice of a 2021 Chevrolet Camaro, 2021 Dodge Challenger, 2021 Kia Sportage, 2021 Mazda Miata convertible. You get to pick. Teresa, have I asked you if you won which car you would take?
Mazda Miata.
Aha. And Jennifer, we know who. Go ahead.
Oh, I'm going for the Dodge.
Yeah, you're
I'm
team
Team
Dodge
Dodge.
all the way. We're going to
Absolutely.
talk more about that. Dr. Kevin Kilday with Holistic Health Center.
Well, as being a former motorcycle rider, I would go with the Miata. You know,
Aha.
just having the wind blowing through my hair. I just love doing that.
So you got to get your tickets. HelpingSeniorsCarRaffle.com. The grand drawing date is Saturday. It's October the 9th, 2021. We're going to be at the American Muscle Car Museum. Your ticket is an admit one to that great event. And by the way, did you get a ticket last year? If you were Troy Darling, you did, and you won a car. If you didn't, you're still going to get to go to the museum because we have our Make Good date for that. That is a Sunday afternoon at the museum. It's going to be Sunday, September the 12th from 1 p.m. to 4 p.m. Mark's going to open up the museum. If you have your 2020 Helping Seniors car raffle ticket, that's going to be your chance to come in, enjoy the museum on Mark. He's going to have soda, waters, cookies. It's just going to be a fun afternoon at the museum. And also, the last thing I want to point out today is October 17th. Boy, it's going to be a busy fall, isn't it? We're going sailing. We're going on the MSC Divina. It's the Helping Seniors Travel Club cruise. Chris Morse, our Helping Seniors Travel Club director, says full speed ahead. We'll be sailing 7 nights out of Port Canaveral with all your friends from Brevard County. So you go to HelpingSeniorsTravelClub.com and get information about that. So with that, we're going to go around real quickly. Business phone number, Jennifer Helin.
Seniors Helping Seniors, 321-722-2999.
Theresa Russell, info on the WEAD.
That would be through the website, www.worldelsderabuseawareness.com.
And Dr. Kevin Kilday, Holistic Health Center.
Yes, 321-549-0711.
All right.
321-549-0711. And anybody suffering from anything, there's always hope, and there's always supplements out there that can help.
Good. And on behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, thank you, John and Jim in the control booth. We'll see you next week.